you. The next question, the member for London West.
Thank you very much, Speaker. My question is to the Premier. Speaker, the COVID-19 pandemic has shone a light on the urgent need for access to childcare in Ontario. But instead of opening up new spaces and providing some stability to the sector, the response from this government is to increase the size of childcare groupings, putting 12-month-old infants in a room with 2-year-olds and making other changes that experts say will result in worse, not better, care. Can the Premier explain why he is using the cover of a pandemic to try and sneak through changes that could harm children in Ontario?
Minister of Education.
Well, thank you, Speaker. Mr. Speaker, 2 years ago when we came to office, we inherited the most expensive childcare in Canada after the former Liberal government.
Order.
That is...
Order. Order. Leader of the Opposition, come to order. Member for Waterloo, come to order. Over here. Government House Leader, come to order. Order. Minister of Natural Resources and Forestry, come to order. Minister of Education, please reply.
Thank you, Speaker. It should not be controversial that we make clear that affordability is a centerpiece of our program when it's clear during this recession, during this pandemic, that we have many people who cannot participate in the labour market because they are hindered by access and because of affordability, compounded by the former government who did nothing to create childcare space. It was this government last year that helped facilitate the creation of 19,000 net new spaces. Our plan is to consult with the sector midstream while we deal with this pandemic to ensure childcare is affordable, is accessible for working parents every single day now and well into the future.
Order. Member for Davenport, come to order. Place your supplementary. Member for London West.
Speaker, it's not just that infants will be placed with 2-year-olds. The Premier's proposed changes would also move 2-year-olds from a room with 15 children to a room with 24 children. There would be fewer trained caring ECEs and non-licensed staff filling ECE roles. Larger rooms and fewer staff is not what parents want, it's not what children need, and it's not what experts and educators say is best. Speaker, COVID-19 has highlighted what families have been saying for decades. We need more high-quality, affordable, public, licensed care, not new rules to water down the care we have. I ask again, why is this government trying to bury these wrong-headed changes in the middle of a pandemic when families are already stressed to the max?
Minister of Education, to respond.
Speaker, what families expect is for the government to work immediately to make sure childcare is accessible for families now and in the future. Let me advise the member what, in fact, this consultation aims to do. We're aiming to improve quality of childcare in the earlier setting, creating flexible options for families, flexibility which does not exist for many parents, creating a more enhancing the workforce retention, trying to work to ensure we have more ECEs within the system. Clarifying the requirements for the inclusion of children with special needs is an important part of this consultation. Ensuring culturally relevant programming is important for new Canadians that come to this country, and reducing the administrative burden and the red tape on those nonprofits, on those organizations that are providing childcare within our community. Speaker, we are working very hard to ensure that parents can get back to work, and we will do everything we can to make sure it is affordable for parents in this province.